Afternoon all. My name is Obi. I work for the Northeast London Cancer Alliance. I'm their prevention, awareness, and screening program manager. And before I kind of dive into kind of cancer screening, I think it might be a bit might be helpful just to kind of give you a bit of context in terms of who we are in terms of Northeast London Cancer Alliance. Um, Northeast London Cancer Alliance, we were formed in the 1st of April 2020, and we are actually one of 21 cancer alliances across England. So it's not just Northeast London. What do we do? So the Northeast London Cancer Alliance, we really help to improve the diagnosis, treatment, and care for our local cancer patients in Northeast London. And to do this, we work with patients, we work with residents, carers, community organisations, hospitals, GP practices, and health care professionals, really, and local authorities, and also voluntary organisations across Northeast London to really provide that focus and a bit more support on cancer screening and other areas of focus, of which there are three. There is screening, diagnostic and treatment, and plan care. So those are kind of our three particular areas of focus. And it's really focused on our Northeast London patients. So I'm just going to turn to the slides now, just to kind of give you a little bit of idea in terms of cancer screening. So firstly, what is population health screening? So this really identifies healthy people or people who have no symptoms who may be at an increased risk of a disease or health condition. Most people actually attending screening will have a low risk of a condition that they're being screened for, although screening picks out those with increased risk so they can have further tests if needed and be treated sooner or given advice on how to manage their condition. The screening journey in our life doesn't just start when you're eligible for screening at kind of later stages of life. Screening actually starts well before that. Screening in pregnancy, as we know, we've got screening as newborn. We've got diabetic eye screening for those 12 and over, and then we go into kind of our three areas of focus. So
I
cervical
hope everybody
screening,
can
breast screening,
see the
bowel
slides
screening,
and they're
and then we
sufficiently
also
large
have
enough.
abdominal aortic
Hi
aneurysm
everyone.
screening as well. So
Thank you so much for
those
that,
are kind
Obi.
of
A
the
really nice
main
summary
areas of
of the work of the
screening
Cancer
within the
Alliance.
NHS.
I'm Lena. I work
In
as a
terms
health
of
improvement
cancer screening in
specialist for
NHS,
the
there are
NHS Bowel
three
Screening
cancer
Program.
screening programs in the
And
UK:
essentially,
bowel,
my role
breast,
is to
and
raise
cervical.
awareness of the importance
We
of
also
screening
do something else
and to
called a
also
targeted
inform
lung
people a bit
health
more
check,
about what bowel
which
cancer
is really
is,
just checking the
because not
effectiveness
many
and
people
of your
actually know
lungs,
much
just to kind of
about it
spot any lung
or
cancers early.
seem to be
There
embarrassed
isn't
talking
technically a
about it
screening
and
service yet,
aren't
but
aware about
it's
how
something that
common
we
it
do.
is.
Not many
So
people know
during
this,
my
you'd be
short
surprised, but cancer
presentation,
screening is
I'll
free
just
of
dive
charge for those that
deep
are
into
eligible,
some of these
and
elements,
participation is
and there will
personal
be an
choice,
opportunity
not
for questions
forced to do it.
anybody has at
There
the
are pros
end
and cons, which are set
as
out in
well.
information leaflets sent with the invite letters that you
So,
get,
I
and
just
it's
want to talk a
important to
bit
read
about
these
what
and
bowel
make a
cancer
choice
is.
with kind of the right
So bowel
information.
cancer can also be known as
Also,
colon
to be
cancer.
invited
I
for
think
cancer
in
screening, you
America they
must
use
be
the word colon,
registered
but if you
with
see
a
either of these
GP.
terms, it means essentially the same thing.
So why do we screen for
So,
cancer?
bowel cancer is
Screening
cancer in
can
any
actually
part
pick
of
up
the
cancers
colon or
early before
rectum.
any symptoms
So
appear.
you can see in the image
When diagnosed early for
exactly
cancer,
which part of the
it's
body it
actually
would be
easier to treat.
located in.
Usually needs less
So what
invasive
happens is
invasive,
as we get
sorry, or
older,
toxic treatments.
the cell
Quality of
renewal
life during
process
treatment
tends
is
to
better,
speed up.
and it has
And
better
what that can end
outcomes.
up doing is forming a
Bowel
polyp,
screening,
also known,
bowel cancer screening reduces the risk of
described as a
dying
clump
from
of
bowel
cells.
cancer by like
And
25%.
the
So
formation of these polyps,
quite
they
strong
get common
outcomes.
as people
Breast
get
screening
older.
saves 1,300
So
lives
as I'll
every year in
discuss
the
later,
UK, and
bowel
cervical
cancer is
screening
actually a
prevents
cancer
70%
that
of
tends to
deaths from
occur more
cervical
in
cancer.
people aged
So that's
50
why
and
we
over,
screen.
although it is the
Just
fastest
in terms
growing
of bowel
cancer in
cancer
younger
screening, I'm
people
going
at
to
the moment
hand over
as well.
to
So
my
even
colleague
more
Lena, who will
important to
provide
be aware
a
about the
bit
signs and
more
symptoms.
information detail around
Um, I'm
bowel
ensure I tell
screening. So I'm
people
going to
that
stop sharing now, if that's okay.
if a polyp is detected, it doesn't mean it's a cancer. So there's nothing to panic about, because some of these clumps of cells can remain benign, but they can turn into a cancer over a number of years. So I think what would be recommended in terms of treatment is, if a polyp is found, it's generally a better idea to have it removed, just to reduce that risk of getting anything a bit more sinister. So how common is bowel cancer? So not many people know this, but bowel cancer is actually the 4th most common cancer in the UK. And it's actually the 3rd most common cancer amongst both men and women. So very serious cancer, very important to pay attention and learn a bit more about what it is and to be aware of the signs and symptoms. So in the UK, almost 43,000 people are diagnosed with bowel cancer every year. It's a very high number. And at the moment today, around 268,000 people in the UK have been diagnosed with bowel cancer. So these are statistics from the Bowel Cancer UK charity. They're doing amazing work around raising awareness as well, and they have brilliant resources. And I will be introducing you to some other websites where you can get more information, also leaflets in different languages as well. More than 9 out of 10 new cases, so 94%, are diagnosed in people over the age of 50. So as I mentioned earlier, it is a cancer that's very common in this age group and above, but younger people are getting it. So the hope today is, if you learn something about yourselves and any symptoms, that we kind of spread the word with everybody, if we can have less embarrassing conversations about this topic, because it does tend to be something people are quite reluctant to talk about. I think people are uncomfortable talking about their bowels, but they don't want to talk about cancer either, because it generates a lot of fear. But what I do want to say is that if cancers are found early, they're incredibly treatable. And I think diagnosis and treatment interventions have significantly improved. So yeah, it's better to actually talk about things rather than letting them fester. So that's one of the messages to take away from today. So what are the signs and symptoms? So the number one sign for bowel cancer is blood in the stool or the feces or the poo. So you can use any term you wish, but that is the number one sign we're looking out for. We're also looking for any changes in bowel habit, such as going to the toilet a bit more frequently, or stools are looser. If there are, obvious things like abdominal pains occurring on a frequent basis, that's something to pay attention to as well. If people notice any changes in their bowel habits, so if they've got diarrhea and then all of a sudden they start feeling constipated, or they feel like they're not emptying their bowels properly, that could be a sign as well. And also if there's a change in appearance or consistency of bowel movements, such as thinner bowel stools. I do want to make a point to say that if you have just one of these, because sometimes we all get a bit of diarrhea or constipation, it doesn't mean you have to panic, and it doesn't mean you've got bowel cancer. Normally what's recommended is, if you've got 3 or more of these symptoms occurring over a significant period of time, say for about 3 weeks, then we recommend you visit the GP. But what I also say is, if you do notice just blood in the stools and that symptom on its own, don't ignore that. Just make sure you visit the GP. And if you are able to do the bowel screening test, do your screening as well. So that I would say is the only symptom I wouldn't ignore and wait to get worse. So I just quickly want to go into what the risk factors are for bowel cancer. So I've mentioned one already, being age 50 and over. In terms of men and women, the statistics have shown that it affects both men and women equally up to the age of 40. But after this, the rates tend to be higher for men. That doesn't mean men are more genetically predisposed to bowel cancer. But what we do think is happening there is that men are less likely to visit the GP sooner as compared with women. So they might ignore the symptoms and wait for things to get worse. So yes, we're encouraging the men not to ignore, and make sure you go to the GP and talk about any symptoms that you might be having. Other risk factors center around health issues that people might have. So if you're diabetic, or if you have ulcerative colitis or Crohn's disease, or particular inflammatory bowel conditions, that may put you at increased risk. So what we recommend is just mention this to your GP, and just in yourself, just make sure you're aware of this, and just take note of anything that might not be feeling right in terms of your bowel health. So other factors such as positive family history have also been found to increase risk of bowel cancer. So if an immediate relative, so a parent or a sibling, has had a history of bowel cancer, then it might put you at increased risk as well. Again, make sure the GP is aware of this. So if need be, they can fast track any diagnostic tests for you, given the positive family history.
If I've got any clothes.
Sorry, I think someone tried to speak, Catherine? Or?
Sorry. I think the microphone just might be unmuted by mistake.
Oh, no worries. Okay, thank you.
You have to mute somebody, whoever that is.
Thanks, Shirley. Okay. So other factors, obesity and a diet high in red meat puts people at risk. So given that this condition is connected to the bowel, we do recommend that people follow a healthy diet. I think everybody knows what kind of foods we should be eating and what we should limit. So junk foods, processed meats, specifically red meats, if we can cut those down and increase our fiber intake, that's very protective against bowel cancer as well. Smoking and alcohol, culprits for other cancers as well. Again, we recommend, if you can stop smoking, then please do. It has a lot to answer for in terms of poor health. And alcohol, if you can just limit the amount you have, that's also a good thing for your gut health as well. I just want to go into talking about the bowel screening test kit that's available on the NHS. Some of you might already know about it. So men and women aged between 60 to 74 in England are eligible for the bowel screening test kit. However, the good news is we've age extended. So eventually within the next 4 years, everybody aged 50 to 74 will automatically receive a test kit. So we're phasing in the ages we send the test kits out to. So we've started with the 58-year-olds and the 54, 56, and so on. So it's a phased in approach. So if you are in any of those age groups, don't worry if you haven't received it yet, but you will do. Bowel screening happens every 2 years. So if you do your first one at the age of 50, you'll get another one at 52 and 54 and so forth. So every 2 years, do look out for your bowel screening test kit. In order to receive the test kit, you must be registered with a GP practice, else you'll miss the invitation. That's where the bowel screening hub receives patients, the data on patients and where to send the kit as well. Also make sure your GP practice has your up-to-date address as well. Otherwise you won't receive the screening invitation. Also, bowel screening doesn't have to stop at 74. The last one will be received automatically at 74. If you do want to continue to participate, you can request a screening test kit yourself. Just wait 2 years before you do that. And there's a free phone number, which I'll be sharing at the end of the presentation, that people can call. We've also got a bowel screening website, which has all the information as well. I will go into what the test kit looks like and how to complete it, but I'll quickly just touch on how the results are analyzed. So it's a test kit that you post away, so you do it in the privacy of your own home. And the purpose of it is to detect tiny amounts of blood in the poo that we can't normally see ourselves. As I mentioned earlier, one of the symptoms of bowel cancer is bleeding. So this test kit picks up on any blood that you might have in your bowel motion. And it's a very sensitive test, and a further investigation will be done if there is blood noticed, and you'll be offered another appointment to check for that as well. The test kit itself doesn't diagnose bowel cancer, but if blood is found, you will be invited for a colonoscopy, which is the most effective way of detecting bowel cancer. And that's when the doctors will be able to check your bowel health, see if what's going on inside, directly inside your bowel. And if a polyp is found, it will be removed. And prior to a colonoscopy, you will actually have a meeting with specialist screening nurses who will go through whether you're suitable for a colonoscopy, and they'll guide you through that whole journey. There's nothing to fear or worry about. You will be supported throughout that whole process as well. After having sent the bowel screening test kit, you should receive your results within 2 weeks, and probably even sooner. So we say the sooner you do your kit, the quicker you'll get your results back. So that's always a great thing, because a lot of people are quite nervous about doing the screening. But I've spoken to so many people now who've done the screening, and they feel really good that they've completed it, because it's just formed a part of their health MOT, and it's just that peace of mind they get knowing that everything's okay. So this is an image of one aspect of the bowel screening test kit. So the bowel screening test kit will be registered to you. It will have your name printed on it, unique barcode. So when you send it back, that barcode will be scanned and your results will be put on the system. And your GP will also be made aware of your whether you've done the screening and what your results are as well. And this is the second element of the screening test kit. So there are 4 simple steps. It's essentially a little tube, and you just have to collect a small stool sample and pop it back into the bottle and seal up the test. And on the websites I share, there are animated videos and loads of resources that you can see, just to look at exactly how the screening test kit works and what people do. But very simple to do, 4 simple steps. Once the sample's been collected, you just slot it back into the cardboard section, and you seal it up and you post it off. And it's literally as simple as that. You do it in the privacy of your own home. You don't have to go anywhere. All you need to do is just put the date on it. I think the trickiest part for people is collecting the sample. But what the research has shown is that once people do it once, they get used to the idea of it, and they're more likely to do it again. So it's just that initial step that people have to take, but it's very easy to do. The old screening test kit required 3 stool samples from 3 different days. This is just 1, so it's much easier and very easy to do, and it's saving lives. I think that's the most important message that we need to remember. Simple to do, and it could save your life. So this is a brilliant leaflet designed by Cancer Research UK. And there are very innovative ways suggested that you can collect the stool sample as well, as you can see. What I recommend, and probably the easiest way, is if you just use folded toilet paper in your hand and poo onto the tissue. Very small sample that's required, and then you can dispose of it quite quickly. But there are other ways you can use. I think we'll be sharing these slides with everybody, so you can have a look here as well. So finally, I just want to touch on some take-home messages that we sometimes forget, because when I speak to people and I mention you have to collect a stool sample, they grimace and they're just not happy about it. And they've got many reasons not to do screening. So I think my role here is to give the alternative perspective. And some of the messages I share with people, and hopefully you can take these messages to your loved ones, friends, family, when you're encouraging them about screening, is that the test kit, the screening program is saving lives. Bowel cancer is being found early, it is being prevented. Some people say, I've got a healthy lifestyle, I exercise, my diet's good, I'm not at risk. But just by virtue of being 50 or over, you're automatically at risk. So it's just worth including screening as part of your healthy lifestyle choice as well. I also hear people saying, oh, I haven't got the symptoms, but it doesn't mean you're not at risk. So another key message to talk to people about. The other thing, the test kit is free. It comes to your home and you can do it at home. You don't have to go anywhere for it. Very simple to do. And for those who don't have English as a first language or can't read English, there are leaflets in different languages. If you call the Bowel Screening Hub, there are bilingual members of staff that you can speak to. So there's loads of support out there to help you complete the test kit. And as I said, once people do it once, they know the drill, they know what to do. And then it just becomes easier And when you get your result, and in most cases results come back normal, people have said that they just feel really good. And I've even spoken to people where bowel cancers have been found, and then they've had that dealt with, the treatments happen sooner, and they've also gotten a lot of peace of mind from that. And these are people who haven't had symptoms, and just by virtue of doing the screening test, the bowel cancer has been found early. So this is a page with resources. So as I said, I think Catherine will be sharing, so you can click on these links, brilliant resources, animated videos. If you need to know more, you can share these with others. There's an easy read guide on how to do the screening test as well. And these are just my details there. If you have any queries, you can email me directly or go via Catherine. And that's the free phone number, 0800 707 6060, that you can call to find out more information. And as I mentioned earlier, we have got leaflets in various languages on the websites I've shared as well. So that concludes my very short presentation. But yeah, we're happy to take questions if anybody has.
Thank you so much.